Hello friends, I'm Dr. Sree Durga. I'm the consultant fertility specialist at Virinchi Fertility Unit. Today, May 31st is the day where we say no to tobacco. Why? We'll find out. And today is a session particularly delegated to know the effect of tobacco or smoking on fertility of both men and women. Well, most people think that smoking only affects, your heart, lungs or blood vessels. But most do not realize that smoking can delay the fertility chances of both men and women. In fact, it is related to the number of cigarettes smoked per day. And studies have shown that, the pregnancy rate decreases by at least 54%. That is 1 year fecundity rate decreases by 54% in smoking women compared to women who don't smoke. In addition, it causes other problems like erectile dysfunction in men, which itself can reduce the pregnancy chance in the couple. The chemicals such as nicotine or cyanide or the carbon monoxide, which are found in the combustible smoke of the cigarettes, they increase the rate of egg loss in women. And typically, an egg is such a tissue that it neither can be regenerated nor it can be replaced or replenished. And typically, women tend to have shorter cycles, that is less than 24 days, which can lead to infertility as such. And women tend to reach menopause 1 to 4 years earlier in smokers compared to non-smoking women. And this could be a major problem in older women who are trying to get pregnant. And coming to men, the effect on the sperm or the damage on the sperm is again related to the levels of cotinine. That is, it's a metabolite of nicotine which is found in the urine. So the higher the cotinine levels in the urine, the higher number of cigarettes you have smoked, and therefore the higher the level of damage to the sperm. And the damage to the sperm is the damage to the count. The count decreases typically, the motility decreases, and even it alters the shape of the sperm. And any abnormal and less active sperm cannot bind to the egg and fertilize the egg. So what we think is, okay, I have smoked for all these years, but we got that the technology has advanced so far, so high, like IVF, etc. They're going to surpass the damage done by all these chemicals that are found in the cigarettes. No, the fact is, this damage done by the chemical content in the cigarettes is irreparable sometimes, and even IVF can't overcome the side effects of these chemicals. In fact, we have observed that women who need IVF and who go through IVF, they need higher doses of stimulating drugs to get to the a decent number of eggs. In fact, whatever the dose or the high dose of stimulating drugs, we get less number of eggs from these women who smoke and they go for IVF. And we have found that after IVF, once we assess this fluid around the egg, which is called follicular fluid, they contain chemicals like cadmium and as well as cotinine. This is the metabolite of nicotine in the follicular level of follicular fluid of this woman who smoke is quite high, and therefore the damage to the genetic material in the egg is high. And sperm in IVF, when we put the sperm around the egg, the capacity of the sperm to bind to the egg membrane, which we call zona, is also less. Smoking affects the pregnancy as well, in the way that it causes genetic damage to the egg and sperm, and therefore the embryo is probably abnormal and it leads to higher abortion or miscarriage rates. Even the smokeless tobacco also increases the miscarriage rates, and smoking has been, the woman who smoke has somehow been found to conceive genetically abnormal children, especially Down syndrome babies. Not only that, smoking can cause damage in the tubes of the woman, either because this cotinine or the other harmful chemicals in this cigarette can reduce the fine hair-like movement in the tube, and also it reduces the way the tube picks up the egg, and therefore the embryo implants in the tube, leading to ectopic pregnancy. Additionally, it is known to increase the risk of the placenta getting separated prematurely, what we call placental abruption, increases the risk of early delivery, the preterm delivery, increases the growth restriction in the baby, and early rupture of membranes, all leading to perinatal morbidity and mortality. It's found that mothers who smoked cigarettes and they had male children, these men were found to have abnormal or low counts of sperm. And we know that, like I previously mentioned, there is growth restriction and early delivery. So children born very small are likely to have diseases in later life like obesity and diabetes. So it does affect even children after the birth. Even you do passive smoking, that you don't smoke, but your husband is smoking, what we can call as husband passive smoking. It can lead to also the same damage or the same risk of reduced pregnancy rates in women who passively smoke, from the active smoking of husband. Not only it has been found that even if both husband and wife don't smoke, but the environmental smoking, that is even a form of passive smoking, can reduce the likelihood of getting a live birth in the couple. Yes, quitting smoking can definitely improve your fertility chances, though the depletion of the eggs cannot be reversed, that is irreversible. And it also reduces the pregnancy complications. So there are so many nicotine replacement therapies like nicotine gums or nicotine patches which can be used, but their efficacy or safety during pregnancy have not been confirmed by many studies. There have been new drugs like bupropion which are found to be approved by FDA, but there are no major studies in pregnancy. So rather than going for nicotine replacement therapies in pregnancy, it's a sincere advice for any couple who are trying to get pregnant to rather start these nicotine replacement therapies in periconception, that is before pregnancy, rather than using these therapies in pregnancy.
Visit Virinchi Hospital for evidence-based treatment.